and move to item number 16, which is 3 reports combined into one item. So quality and safety meeting, quality and safety report, and this also incorporates the 6-monthly safer staffing report. So basically, Natalie, John, Janet, whichever order is going to do it, away you go, please.
Thank you, Mark. I'll go first on the report of the meeting and then hand over to Natalie to pick up the quality report and the safer staffing. A number of the items, as you will expect, have already been touched upon this morning, but I'll pick out just a few of the key ones. The first one's around we have been having quite a discussion at the committee under the board assurance framework and the high level risk register item for the past few months really, about the consistency of the risks that have been coming forward to the committee and also the way they're articulated. And Jill has been updating us on the work in progress around around improving that. And in fact, we did note at the last meeting that actually there has been an improvement that we could identify around actually how the risks are being articulated. So I think that's a positive piece of feedback I'd like to give. At every committee meeting, we do spend quite a considerable amount of time going through the improvement plan because our committee is charged with oversight of that before it comes to board. So we've had quite a big discussion around, well, as you can see here, around in particular around the triumvirate model of within the structure, but also the importance of the patient voice and our need for assurance that the patient voice is being heard and that the improvement plan will actually impact positively for patients at the end of the day, because that's actually why we're all here, isn't it? So we have been having those discussions, and in fact during the meeting we do have an attendee from Healthwatch who comes along, and they gave a very positive example of how they feel services are being improved and the feedback that they're getting. We also had sight of the new integrated governance guide and felt that actually that was a really, really useful guide, not only for the committee, but also for staff themselves. So I wanted to feed that in too. We had sight of the draft quality account. You'll know that this is an annual requirement that we publish. And it has a set way of being put together. So we examine that. We will be having a further draft because it has to go out to be seen by quite a number of people, and then it will be published on 30th of June. So I anticipate it will need to come to the next board meeting for sign off. Other items for discussion, we noted that there's been Risk Summit, which is actually being held the same day as the committee. So Natalie may be able to give us some update, but we're anticipating an update to the July meeting around the Droitwich, Obviously and Rural's physical health neighbourhood team, and how some fragility within that team around staffing and workload. So we will be getting an update at the next meeting. As far as emerging quality concerns go, we've noted that there's a new policy on visiting, which will be out for consultation and will be getting signed off in July. And we did note the item that Matthew's previously reported to us today, which is around the mental health patient survey and how positive that was. The other item I wanted to pick up, though, because we actually noted that was something which we wanted to report today, was around assurance mechanisms, because I think it's increasingly clear that patients are waiting, and I think this was linking in particularly with community paediatrics. But we'll note throughout reports that patients are waiting for services, and we have mechanisms at the moment for supporting patients waiting, so that they're not just on a list and not being considered. But actually, there's a need to actually have a scoping exercise to look at that and ensure that services with significant waiting times, the patients are being reviewed and we aren't missing out, issues of patient safety and patient experience. So at the moment there are waiting well approaches with letters that are sent out, but I think we discussed the fact that there's a need for actually reviewing those, particularly if they're going to be rolled out to other services. So that was something which we wanted to report to the board today for assurance. I think that was all I was going to pick out that wasn't in the quality report. So I'm going to hand over to Natalie now to pick out items from that and to comment on the safe staffing as well. Except Martin's got a question.
Yeah, I was going to say, before we do that, we need to just agree the assurance levels that you've suggested in that report as well, which I don't think will be a problem. But Martin.
Thank you, Janet. And I just wanted to pick up on the point around the waiting well, and to return to my favourite subject, that when we are looking at people who are waiting, that we are taking due account of their individual circumstances and inequalities, and particularly with the report that we've had around Herefordshire and Worcestershire about the low level of health literacy associated with that, sending out letters might or might not be appropriate if the people don't understand the letters that they're receiving.
Yeah, thank you for that, and I think you've articulated far better than I did. Why we're going to be looking at that. But your presence also reminded me, when I thought you were going to ask a question about the internal audit, because I was going to pick that up, and when I saw you, I thought he's going to pick that out. So we did have 2 internal audit reports, both of which actually gave low assurance. I'm just flicking through here. I think I can do it from memory. One was around ECT, and one was around patients going absent without leave, and I think recently again, the way those audit reports have been pulled together, and the fact that actually the action plan is looked at by execs, and the managers actually have the opportunity to comment, means that the action plans that are coming to committee are far more robust. And I think, although both of these internal audits had low assurance, I think we were assured by the action plans that were being presented. So I just wanted to pick that up before I hand over to Natalie, or any other questions.
Any other questions at all? There's one point I was going to make, Janet, which is I've had conversations with Robert about waiting lists, plural, in that there are a number of them, obviously, for our services. And Robert tells me we used to have, for want of a better term, a dashboard around waiting lists of the various sorts. I've asked Robert to consider how we consider our waiting lists together, to see if there are any common issues, and that will filter through to your committee at some stage, undoubtedly.
Thank you very much. Thank you.
If there's nothing else there, can we approve Janet's committee report with the associated assurance levels? Take that as a yes, no dissent, and then move to Natalie. Thank you, Janet.
Thank you. So the summary quality report, although I'm sure the Trade Descriptions Act might have me for that title because the summary is getting longer, I'm afraid, as we incorporated some medicine safety into this report for the first time. The exec summary gives an overview from a safety, effectiveness and experience perspective. So I'll take the report as read. Items I'd like to highlight are our transition to PSERF. So you'll see some different language in some of the reporting. So we talk about patient safety incidents, and that adjustment has gone well. We're working with the thematic groups to really focus on the key themes for our patient safety incidents in the organisation, and you'll see a natural reduction in the number of what's called serious incidents as we transition. And again, a few items of improvement that we're picking up are underway. In relation to effectiveness, again, for those of you who aren't overly familiar, the Sequin data is contained. It was severely impacted by the Care Notes outage in our relation to be able to pull effective data. And just to confirm to board that Sequins will not continue for this year 24-25. However, a number of Sequins that we haven't got the trajectories that we would want to will continue as internal audits. So those quality initiatives will continue, but they'll continue to be reported internally. And finally, on patient experience, the really positive rollout of care opinion and of the first summary of that's contained within the report, and an increase in FFT, which is an artificially reported increase as we amended how those reports are being administered. So a backlog of reports was added. but I can happily take any questions on the full report.
Any questions at all? And just to point out to colleagues that Sue has kindly put in our comments, the comment section, the report with regard to health literacy for in relation to locally. So if anybody wants to look at that, and you can find it in the comments section. Any questions for Natalie at all? No? Okay, can we note that report then from Natalie, please, and the associated assurance levels that are contained, and then move Natalie to safer staffing?
Yes, thank you. This is the 6 month safer staffing between September and February. There are no particular items and notes. It remains very static position that we see our fill rate. So we have the number of staff working shift as appropriate according to safer staffing establishments. However, the majority of that is because we use temporary staffing to fill those gaps. The piece of work then connected with Arise in relation to reduction of our vacancies is key now in relation to safer staffing work. You may note that the assurance level has been reduced by 1, and that's due to one of the tools that we use for safer staffing for the community hospitals, which is the Safer Nursing Care tool. The algorithm slightly changed, so we have less assurance about the results that came from that this time, and it will need a second cycle for us to fully understand the implications of that. And again, happy to take any questions.
Any questions at all, Martin?
Yeah, thanks for that, Natalie. And I just wanted to pick up on your comment about it's very static compared with our financial improvement plans, which Denise mentioned earlier, is pretty much dependent on our agency nursing, agency staffing position moving quite significantly this year, and I'm just wondering what assurance we get around that juxtaposition of fairly static versus a significant movement required to meet our financial challenges, and what's going to shift the dial.
Yeah, so I think there's 2 different approaches, Martin. I think there's the one around the longer term vacancy solution, so the intention to have 0 vacancies for our healthcare support worker within 2 years, and then it's longer for registrants. That will have an impact, but the more immediate work is the work that's been done by the agency reduction group, and that's seeing the shift from using more temporary staff through NHSP, and then moving from higher cost agencies down to lower cost agencies, and that's the dial that we're really seeing shifting. So using different incentives to try and increase NHSP fill, to the work we're doing about reducing and going to a 0 use of off-framework agencies. That will turn the dial from a financial perspective, but also from a quality perspective. So the use of more regularly known staff to our inpatient wards is a real quality benefit as well.
Thank you.
And if I may comment on that, looking for good news as we all do, if you look at page 271 of diligence, you'll see the graphs there that show, although Natalie suggested the dial isn't moving, you can see some significant improvement in recruitment there, notably amongst mental health staff. Actually, I think with the exception of RNs within the community hospital setting, they're all going in the right direction. And for information aboard, I was at, I think it was Cantaloupe, and the ward manager was very proud to tell me that he'd converted an agency member of staff into somebody that applied for permanent and was now an employee of the trust. And apart from the fact that that's pleasing, but the attitude of the ward manager was the most pleasing thing, to see that he was actively trying to convert agency workers into substantive workers based upon the benefits they can get from being a substantive employee. So there is some movement, Natalie, and if we can keep that Arise programme focus and keep that improvement going, and I know there are other plans which are maybe in the next report we're coming to actually, let's just keep our fingers crossed for those movements. So can we agree the safer staffing report with the comments as suggested by Natalie? Yep, that's all agreed. Thank you, Natalie. If we then move on to the next report, which is for assurance, which is around the workforce committee. So Vina and Elaine. Vina.
Thank you, Mark. So I'll assume that everyone's had a chance to read the paper. So I just wanted to highlight a couple of key areas of development since the last Workforce Committee and the last board meeting. We've already talked about the extraordinary meeting that we held on the 22nd of April in relation to the staff survey results, so I won't repeat that. In terms of the full Workforce Committee this month, we have had a bit of a reset, and that process actually started some months ago, as Tessa previously mentioned at board, and we will no doubt continue tweaking how we work because we recognise that it's not as effective as it could be. And with that in mind, we have introduced a continuous feedback survey process on how we are working as a committee. So it will be interesting to see how that turns out. In terms of assurance levels, generally they haven't changed very much for quite a while. Again, an indication of that need to improve our effectiveness as a committee. On the positive side, we discussed the proposed resolution policy that Robert mentioned earlier today. It's currently in draft form, and a key part of the improvement plan is around how we resolve disputes and manage staff in a compassionate and inclusive manner. And the proposed resolution policy it's a fundamental part of that. This is going to be quite a step change in how we manage employee relations issues, with a move away from that very directive and at times unintentionally painful way of addressing issues. And we're trying to move to a more restorative, just culture approach, which we know has been really successful in other NHS trusts. But we can't just make this yet another policy that gathers dust. So in order for it to really make an impact, it's going to need a lot of input to bring it to life and ensure that everyone knows how it works. So an implementation group's being put together, which a number of very talented, experienced people are going to be involved in, including colleagues from staff side, to help us get to a place where those painful issues can be managed in a more effective way. Coincidentally, you will have seen in the board papers a breakdown of employment tribunal claims which have been brought against the trust over the last few years. The observation that's been made in that commentary is that a number of those cases have arisen from circumstances that have soured the relationship between the employee and the manager, with the employee then commencing a period of sickness and never to return to work again. And eventually that has either led to a dismissal or a resignation and then a claim. Our hope is that it's precisely those sorts of scenarios that can be minimised by approaching these issues in a different way, with a greater emphasis on mediation and efficient fact-finding exercises, rather than these prolonged investigations, which often is the start of those long absences that we've seen. On the subject of sickness absence, we also had a deep dive into our sickness absence figures. We know it's a contributory factor in relation to our risk areas around staff shortages. So there was a constructive discussion about what we're doing, what we could be doing better, and how we can empower and enable our managers to address this. It will form part of that leadership and management development offer. I think the full programme is due to start later this year. So we had a good discussion about that. Also, our Freedom to Speak Up guardian, Natasha, has introduced a manager's guide to speaking up. And that's been put together to support managers in how they respond when a concern is reported to them. We saw also a really good kind of a meaningful implementation plan for that, which includes the provision of support and online training for managers. Those of you who've done the online training for the freedom to speak up. You know, it talks about the need to speak up, listen up, and follow up. So this manager's guide is part of that follow up. It's about making sure that concerns aren't ignored or addressed inappropriately. I think that's it. I hope that highlights the fact that, you know, we recognise the need to progress. We absolutely recognise the need to shift those dials, and we're trying to be as focused as we can be in delivering our organisational priorities. I know that Scott is working with teams to really drive that customer focused, patient-centred mentality, because ultimately that's what we're here for. So other than that, I think that those are the main points I wanted to highlight. If anybody's got any questions?
Any questions, anybody? It's clear, Veena, you've hit the ground running with your new responsibilities as the chair of Workforce Committee. Thank you. If there are no questions, then we look forward to those matters of progress coming to better fruition. So good work. If we could note that report, please, and then move to the workforce report, Elaine.
Well, I have to say, Veena kind of covered most of it. The additional points that I'll bring to board's attention is around the management of sickness, I think Veena mentioned, but also increasing the quality of appraisal. We are below where we should be, which is a target of 95. We're at about 88.9 at the moment. Real focus on increasing that. One of the things that has happened is we've absolutely stripped back the pro forma. We have a much simplified approach to it, a greater emphasis on preparation for one-to-ones and the appraisal process by the appraisee and the appraiser, and developing a toolkit and some checklists to support that process as well. And just emphasising the point around the work that's being done in the Freedom to Speak Up space as well, which will be integrated into our management essentials. A bit of a triumph, really, in terms of the resolution policy, in so much I had an issue that came up, and it did come in as a grievance and could have gone the whole way. Took the opportunity to have more of a conversation rather than an automatic move to an exchange of emails, which will increase in attrition, and we were able to resolve it in, I have to say, a matter of days, for something that would have taken probably months had we taken a formal route. So I can say that it absolutely does work. It's more talking, less exchange of emails, the preparedness to listen to what the issue is. So where we are with that specifically is it's now with staff side. Absolute clarity about it's been agreed in principle. Workforce Committee will be progressing to formally signing it off at July's Workforce Committee. So that's where we are on that. Veena's already talked about the employment tribunals. On wider staff relations issues, we've seen a bit of an uptick in staff inappropriately accessing things like care notes. So there has been a lot of work in just reminding staff about their responsibilities and potential actions that can be taken as a result of that. We're motoring on with the development of the Management Essentials programme, which, as I mentioned earlier, is going to be soft launch at our SLT conference on the 4th of June, with the intention being to formally roll it out in September. Well, I'll take it that colleagues have had the opportunity to read the detail of the report, and happy to take any questions.
Any questions from colleagues? No, I think that plays to the reports that you've presented, Elaine, Veena, and the comprehensive nature and succinct nature of them. So thank you. One couple of comments I'll make. Congratulations to you and Natasha, 20 Freedom to Speak Up champions in post now, and I know to be developed. And I know Freedom to Speak Up has been a key focus of this board, and to see that development going on, and hopefully the ongoing support because I know it's not an easy area of the trust, and it links into what you've just mentioned about grievance and those sort of things. So it's part of a bigger picture. So congratulations on getting that done, and also congratulations on your new member of staff, who I think is with us today, observing as part of her induction. Naomi Keeling is Deputy Director of People Directorate, and will be a great support and some additional capacity and knowledge within the team as well. So if there's nothing else, can we note that report, please, and its contents, and move then on to F&P, please. Beach.
Thank you. Thanks, everyone. I'll let Denise pick up on some of the detail, but I think I'll just draw out some of the highlights or the most important points that we discussed at the last session. Firstly, and very good news, and congratulations to the team involved, that the financial position for the end of the financial year was an on-budget and on-plan performance, delivering a 2.9 surplus, which is what we planned to do. So that's... Sorry, Mark. Were you going to say something?
I wasn't. It was supposed to be a clappy hand emoji, and it turned out just to be me putting my hand up, showing my incompetence at the use of the technology. Apologies, Beach.
No, don't worry. I saw your hand up, so I thought I'd take it now. But anyway, and yes, no, I share that. It's a congratulations to everybody involved, and it's not easy to deliver with the backdrop of the financial restraints and considerations that the whole of the sector is working under. It's a remarkable performance. Notwithstanding, I think we're in for a tough year ahead. From a performance perspective, there's no new recovery plans. Suffice to say that the children's and young persons' mental health access rates are still very, very challenging. The team are looking at this, and it remains a focus. NHS Oversight Framework, the NOF, there's a process of self-certification that will be introduced. Again, we can pick this up in more detail during Denise's part if we wish to, but discussions are underway, consultations underway throughout this month, and expect more once we're in a position to talk about that once it's finalised. And then finally, just from my position as the chair, I'm reflecting on the fact that we some months ago changed the agenda around to talk about the BAF and the risk registers right at the beginning of the conversation. And I think that looking back now, I think it's given a more balanced conversation. It's richly risk-based, albeit it still focuses on what we're doing and how we're doing it. I think it complements the assurance and governance aspects of the agenda's items that follow on from that. So I think that's just my reflections from the last 6 months or so of just changing that agenda around. I don't have any other points I wanted to draw out, the details in the report, but I'm happy to take any questions.
Any questions for Beej at all on his F&P report? Thank you, Beej. And I forgot to mention in relation to Vina's report, but it's applicable to F&P as well, is her innovative feedback process that's applied to workforce to seek improvements, to seek views. We, as non-executive directors, and Jill will get into a discussion, and Robert, about whether we can widen that out to be a feedback improvement process for all our committees and indeed this board meeting. Anything that increases our effectiveness is to be considered, and it looks like being piloted in workforces appears on the first cut, looks to be quite successful, but we will be having those discussions. Thank you, Beej. Everybody happy to note that before we move to Denise? Okay, thank you. All noted. Performance report, Denise.
Okay, thank you, Chair. So just to pick up some key themes from the performance report, the adult mental health access targets at March was just a slight shortfall. The final submission date is next week, so we're working on to make sure that we capture all late data entry. So the deadline is the 20th of May. Just worth noting that we have got a new target for 24-25, and there is a reduction next year, and that is due to some changes in the criteria. We're just working through that at the moment. It is also worth noting that since December 23, the trust is no longer in the bottom quartile for this indicator. However, in 24-25, we'll be measuring our activity against the new measure and the old measure, just to make sure that the activity is consistent levels. Just picking up on the children's mental health access target, this does remain their biggest challenge. We were significantly a shortfall. A recovery plan is in place, and additional mechanisms for capturing and inclusion of appropriate activity has been discussed and agreed with the services. And again, next year, the target does change, and we're just looking at that in more detail. Talking therapies, again, a recovery plan in place for the access rate. Just worth noting that the talking therapies target is changing again in 4/5. So therefore, we will need to go back and look at the recovery plan, and that work is in hand between the informatics department and the service delivery unit. And then finally, the recommendation assurance level 4 that was approved at F&P committee. We will need to look at that going into 4/5 with the new metrics, and that outcome of the work will inform the next assurance level for that report. And then Bede just alluded to the change in the operating framework that is currently out at consultation. That consultation, I think, finishes tomorrow. There was 11 questions that we had to just give our comments on, which we did, and more detail is to follow on that. And that'll probably be updated in the next report at Finance Performance Committee if we know anything further.
Okay, does anybody have any questions on the performance report, which I think is good and succinct and captures it nicely? We're being asked to note the report, which includes those levels of assurance as described. If everybody can note that. Yes, thank you very much indeed. And we now move on to the finance report. Denise, again, thank you.
Okay, thank you, Chair. So as Bede just said, that month 12 report. So at the moment, we have delivered our plan. That is obviously subject to auditors, so they're still working with us over the next number of weeks. I'm not hearing any noise or any issues coming out of that audit, so good news so far. So we delivered the plan. The efficiencies, there was a significant £10.3 million efficiencies we had to deliver, which we did achieve, and most of those were delivered by month 11, which is really good news. And thank you for all that was involved in that. Agency spend, we slightly missed the target by £1.5 million. That was consistent with the forecasts that we'd looked at during the year. But there was a great effort in reducing agency spend from the previous year. It did go down by just over £5.5 million. Good escalations and processes were put in place and management controls. So there was a real drive down on agency spend. And then we did have a full capital programme in place of nearly £18 million, which was all delivered to plan. And we spent all of the money, which was really significant. So the big one for us during the year was the dormitories programme. So we saw the conclusion of Worcester that finished in the autumn, phase 3 of Stonebow, and we're just entering into phase 4, which will conclude in August 24. That's all I wanted to pick out, Chair.
Thank you, Denise. Anybody got any comments about that financial performance month 12? Well, I've got one. Well done, everybody. I mean, it's not just Denise, Robert as the predecessor. It's everybody on this screen. You know, Matthew, you've got a lot of people in your directorate are the ones that are spending the money, you know, through the SDUs and everybody else. So it's an absolute team performance up and down through the organisation to deliver the financial plan on target, including the cost improvements at around 10 million, I think Denise says. I know this has got to go through its full audit process. But at this moment in time, I think it's good news. It's not an easy thing to have done for any NHS organisation, but we've managed to do it. And I'm going to suggest something different. We appear to have gone for an assurance level of 6 on this. Well, I've done the maths, and 1 5 and 4 7s, to me, that's high enough to be a assurance level of 7, as far as I'm concerned on this. Because, and the deciding factor on that agency is, yes, we didn't meet our agency target of spend, but every pound that was spent on agency over our target was paid for by a pound out of our budget. It was not in any way an overspend of our budget. And so we've contained any excess agency spend. So it's not, agency to us becomes a quality issue and a motivation morale issue to our staff, not necessarily the financial overspend issue. So I'm recommending to board that is an assurance level of 7 on the end of our year 12 performance, based upon what I've seen in this report. I'm happy to be dissented with.
Thank you, Chair.
We take that as an assurance level 7 then, please. Congratulations to the organisation, I think, is the message there. It's my favourite report of the year, that and the one that goes into the audit committee with hopefully, fingers crossed, an unqualified opinion as well. Thank you, Denise. Thank you, Beej. If there's no further questions, then we can note that report and move on to audit committee. Martin.
Yes, thank you, Chair. So actually, Denise has covered most of it in terms of the focus of this committee was around the audit. We've got no areas of concerns from the external auditors been raised, or the internal audit when they've issued their draft internal audit opinion, which is positive at the moment. There's a few things to finalise. And then the other key areas that we discussed was a lot around the risk management strategy, which we've already discussed on this agenda. And the third element, the committee effectiveness review, which is incorporated later on in the agenda as part of the board effectiveness review, and some of the issues associated with that, which we've already talked about in relation to perhaps workforce committee having a bit of a reset and looking at how we do that better, and just tweaking what happens around some of the other committees. But everything else is on course.
Any questions at all for Martin? No? Okay, can we note Martin's report, please, Audit Committee? Thank you, Martin. And then move on to our Mental Health Joint Committee. Carol.
Thank you, Mark. Yes, I think what's worth noting here is that we've already covered most of the performance elements of it under other headings, which I think is absolutely right. I think that we will start to see the real benefits of this joint committee when it's on some of those things that we are not totally responsible for, and that we are relying on other people to help us deliver. And I think the dementia diagnosis rate is going to be a little bit of a test bed for that. So we'll look forward to hearing some positive stuff on that coming forward. Most of the stuff is said in the report, but I think it's just worth picking up on some of the assurance point of view that the schedule of deep dives that we've got going forward will include out of area placements, LD and autism, section 117, and health inequalities. But ideally, what we want to do is embed health inequalities in each of those other headings. So if they're not included in the reports, we'll be asking about those. And finally, just to say, just to make sure, it's interesting, Mark, you circulated the ICB papers, and it was good to see that although our reports look basically different, they look quite different. Actually, what's in the information that's in them is pretty much the same. So that means that our consistency of reporting is working. And I'm meeting my joint chair, Sarah Raystrick, next week, just to make sure that we're both clear about where the committee is going and that we've got the right things that we're discussing.
Thank you, Carol. Any questions on the Mental Health Joint Committee? And I think you're right, Carol, the work really, I think, kicks off and across the system now, isn't it? And having yourself and Sarah as a joint committee, as a joint chairs, I think is a real positive step in demonstrating it's a system committee. Not we might host it, but it's for the entire system. Okay, can we note Carol's report, please? And then, yes, thank you very much. The next one is the Mental Health Ledge Committee. Sue, unfortunately, can't be with us, like I say, she's on alternative business today down in London. so we can take it as read. If there are any questions, I'm sure Jill will be able to answer, but as you can see from the report, everything is broadly as it should be. Has anybody got any questions at all? Martin?
It is just one comment around that we discussed in Mental Health Legislation Committee that I think should be brought out. We've got increasing evidence that there is an inequality in the around the ethnicity of people who are sectioned in Herefordshire and Worcestershire. It's consistent across the country, but it's now coming clear through our numbers, which previously didn't, and we will be looking at that in more detail to understand why that is. A lot of evidence is around late presentation into mental health services, and we need to understand how and why, how we can address that more effectively, because it hadn't previously shown up in the numbers, but is now.
Can I ask an open question? I have no idea if the right answer. Is the right place to discuss that in the Ledge Committee, or is it elsewhere so it'd be discussed, or both even? Because it strikes me that perhaps, you know, Carol's committee and elsewhere. Natalie?
Thanks, Mark. You took the words out of my mouth. It's great the committee have spotted it. As Martin says, it's nationally a known issue, and it's part of the driver for the Patient Carer Race Equality Framework, PCREF. So we are obviously in our initial stages of looking at our work streams for PCREF. Sue's kindly set up and chairing an equalities group. So we now have a place where PCREF will sit and report into, and it should absolutely fall under one of those fundamental parts of that work stream. But yes, absolutely then discuss through committee and safety and quality.
Okay, thank you, Jill.
As we're doing a piece of work at the moment with public health in both counties and the AMP services in both counties to actually do a deep dive into the data, and I would expect that would come back through a number of different routes, because I think it's probably equally applicable to the joint committee as well as quality and safety. And so I'd expect actually, once we've got the report, which is a multi-agency approach, that we would bring it through a number of different mechanisms.
Thanks, Jill. So nothing less than I expect more inequalities champion, Martin, in ensuring that any inequalities in whatever service they are to be brought to the attention of our board here. Okay, can we note the Mental Health Legislation Committee paper, please, for assurance? Thank you. And then we move on now to a certain extent, marking our own homework, although plenty of others mark it for us as well, I think it's fair to say, and that's the Board Effectiveness Report, which has got a number of elements to it. So if I hand over to Jill. Jill.
Yes, I'll start off talking about board effectiveness, and then I'll probably hand over to Elaine about board development, because that's very much her professional bag and expertise. So we started off with the various committees conducting their own effectiveness reviews. In April, we had a report to audit committee looking at that, which, as Vena's already set out, identified that we need a bit more focus work with workforce committee. We have plans in place to take that forward. We also have a number of other areas where we have looked at whether we are effective. So we have looked at conducting a self-assessment against the Code of Governance, which I'd brought through a development session last month, and that's set out there. The Code of Governance effectively sets out best practice in corporate governance standards, and so is a useful position to focus on whether we are, one, fully cited on the best practice in corporate governance standards and where we sit alongside those. As part of the annual appraisal that Mark has as chair of board, we seek feedback both from board members and from external partners about primarily how Mark is performing and leading the board, but obviously a key part of Mark's role is ensuring the board is effective, and so there's some areas there that we've also taken out. I think one of the key elements that partners made in one of the key areas of focus that partners made in that regard was about the need to drive the performance of the improvement plan and deliver the changes that are needed to actually move the organisation forward, and clearly that's absolutely a key focus for the board. Having brought all these things together, one area that I think we clearly do need to do further work about is ensuring that we are at board focusing on the right areas and the papers are concise and succinct. And this was something that we'd flagged last year, and it felt as though we'd made some improvements, although it does feel as though our board papers have got very long again, and I think there's a further discussion to be had there about how we can actually try and ensure that we have board papers that are not so extensive that you potentially miss what the really cogent points are, and working on the executive summaries so that we are absolutely focused on that. And I think that's got to be a key focus moving forward. Part of the whole process about obviously looking at how we've performed over the previous 12 months is to then inform what are we going to focus on going forward and how are we going to support that through our effectiveness, through our development programme. And so if at this point I just hand over to Elaine to then talk about the element of the proposed development programme, because I think that very much builds on the improvement plan work that we're undertaking and the key areas of focus that are set out in the improvement plan.
Okay, thanks, Jill. As colleagues will see, it's Appendix 2 as part of the papers that have been circulated. As Jill mentioned, this builds on the programme we started last year. We're continuing to do that. It's part of our ethos of listen, learning and improving. And I think we had some real successes and opportunity to do some critical reflection following the sessions that we had this year. We're continuing to do that for this coming year with a view to starting it in September. And the intention is that we pick up some of the feedback that we've had as part of the CQC, but also integrating our ambitions that are part of the improvement plan. As I mentioned, of continuous learning and improvement, demonstrating and aligning to the behaviours that we've identified in our Behaviours for All document, demonstration of our commitment to be a just, inclusive and fair organisation and linking that into our EDIE strategy, and ensuring that we are visible, accessible and responsive as a board. So the programme has been designed to pick up some of these issues, to continue to have some of those conversations around that as a reflective piece, but also experiential as well. We'll continue to do some of our what we call transactional events as part of board development, but I think we should see these as a continuous journey. The intention is we start it in September, and there may be things that come along as we develop the programme. There may be things that are not in here. What I've done is try to ensure that we align to what we know needs to be done, that it is linked to our improvement plan and our cultural change journey that we're on at the moment. So I'm happy to take any questions. The intention is we keep it as an experiential process. It's not just sit in a room and someone presents to us. It's about having those conversations that allow us to do some of that critical reflection and challenge ourselves as well. So I'm happy to take any questions if anyone has any.
Okay, thank you, Elaine. Thank you, Jill. There are a number of elements of this report in relation to our effectiveness and our development. Does anybody have any questions or comments or points of clarification that they wish to make on this? No? Martin.
Yeah, thanks. I just wanted to really ask a question around, because one of the areas we've got for board development, and I think it leads very aligned to committee effectiveness, board effectiveness, is the data that we have within this organisation, but particularly the data we have as a system, which is somewhere behind other leading systems in data. And I just wonder if we, how we're throwing our weight behind moving Herefordshire and Worcestershire towards a much more integrated data environment that we can learn, particularly around health inequalities, which you might expect me to do, but also around some other areas, because we need to get that alongside the development of the board, so that we actually have the information required.
Yeah. I have a couple of thoughts on that, Martin, which I'm happy to explore. Certainly, I think there is a lot of untapped data through our public health colleagues. I think there's probably untapped data through our patient groups. We've mentioned PCREF. I think there are probably organisations that are local to us in our system that we can draw on and bring some real experience to in the room and challenge to us as a provider. So those are just some examples that are in my thinking at the moment. Happy to hear from others as well about how we might do that, but there are certainly some other data sets that we can pull on.
I noticed Robert wishes to come in. I did wonder whether Lisa wishes to offer comment with regard to the digital setup across the ICS and with the reference now moving to Katie Hartrick. But Robert first.
Yeah, actually, it was that point I was going to draw Lisa in, because you're right, Martin and Elaine, there's things that we can do with data we have and maybe what we draw in, but the bigger question here, I think you were referring to, Martin, is how we've drawn that together. And I guess, Lisa, we've got a new lead within the ICB, but probably helpful just to hear some of that and probably some of the things we've talked about in terms of what we're trying to do for the coming year.
Yeah, certainly. So as Mark and Robert have alluded to, we have a new Director of Digital and Data and Technology within the ICB, although it is a shared role with the Director of OD as well, so it's not a dedicated role. I've met with Katie on a couple of occasions, and the conversations that we've had is certainly around the promotion and the increased use of the shared care record in order to pull that data together. We've had a number of conversations around how we can fund that development and continue that development. Even the lack of national monies is there, and we've got some ideas of how we can do that. And I know it's a little bit sketchy on details at the minute, but there is the federated data platform from NHS England that we need to pull together and how we can do all of that. So Katie is absolutely on board with the shared care record and improving the access and the usability of that. And that's a strategy that we will be doing moving forward. Conversation that Robert and I have had is around the development of two strategies within the digital area of ourselves within the trust. One of those is around interoperability and integration and how we do that better, particularly with the new EPR coming forward. So that strategy is something that I will be developing over the next few months, and that will pull the data element into that strategy. The other one is around citizen access and citizen usability of data, so how we promote that and how we do that better through a portal, NHS app and those sorts of things. So again, those two strategies are what I will be focusing on the coming months, but the shared care record is definitely on the table and something that we need to be working towards.
Claire. So I'm going to apologise, Claire, and say, Claire, I'm not 100% sure what your title is in the organisation, but you're very welcome. And if you've got a contribution, please make it.
I'm Claire King, Safeguarding Services Manager. And I just wondered, I may have missed it in the report, but where does the Integrated Safeguarding Committee fit within this? This committee feeds into the Quality and Safety Committee, but I can't see that it's been referenced, and I just wonder if that's an oversight or or whether we need to be included in that.
I'll allow Natalie will pick that up. We're receiving the safeguarding annual report very shortly. I know it's been elsewhere, but I'll ask Natalie to pick that up when she mentions that, if that's okay, Claire.
Okay.
Okay, thank you. Anything else on the board effectiveness? We're being asked to agree the programme as set out for our own development as a group of people charged with trying our best to lead the organisation. That's not saying it's static. If it needs to change, as Elaine said, it can be dynamic and we can weave things out, take things, whatever comes in from the side to impact upon us, that can change. And there's also to note the rest of the content of the report, which is more or less around self-assessment. Can we do those two things, note and approve? John?
I'm really sorry, and this is probably coming in a bit too late to this. We mentioned a lot of stuff in Appendix 2, but the overarching framework of all that we are doing is the NHS impact, and I don't know if this document is going to be kind of looked upon as evidence for well-led. I don't know whether it's worth mentioning somewhere. The NHS impact framework, which we are working on?
I'm either being a bit slow or missing the point, John. I know NHS impact is about quality improvement. Board effectiveness is about improving ourselves as a group. So can you just probably explain a bit more, please?
So the NHS impact framework is much wider. It's, I think, constituted of about 5 pillars, which is more of an organizational approach to becoming more on improvement and effectiveness. And I think what is mentioned in the appendix and the content of the report very much covers what's in the NHS impact, what is required of the NHS impact around leadership development, improvement plan, and everything else that we are doing around culture, strategy setting that we're going to do later this year, etc. It's just that we haven't mentioned the word NHS impact somewhere there. I think it's just a suggestion, just in case the CQC or any other regulator take this report and just wondering why we haven't considered the NHS impact framework.
Okay, well, of course we have, and we've even had the NHS, we've had Anna come and talk to us about it. So maybe that can be incorporated and recognised within the minutes for this meeting, Jill, to ensure it's recognised that this, although not mentioned in the report, it's a fundamental part of what we do, and actually boards had a complete session on impact. Thank you, John. And with those comments, if we could note the report and approve our development programme going ahead. Thank you very much, which then takes us through, allied to this, terms of reference, which I know would have been through the committees. Jill, do you need to say anything about this at all?
No, hopefully it's self-explanatory. Happy to take any questions.
Does anybody have any questions? I know that they've been through all the relevant committees. If no questions, I can't see anybody. Can we approve those terms of reference for those committees, please? They are approved. Thank you very much. Reports considered elsewhere. The medical devices annual report was considered by Quality and Safety. If anybody wishes to refer to it, you'll find it on Diligence. With regard to the safeguarding annual report, Natalie, did you wish to, although it's been considered elsewhere, did you wish to say something about this?
No, so both reports were considered at Q&S in detail. They're both mandated annual reports for board. I think particularly the safeguarding annual report gives you a really good oversight of the breadth of the safeguarding team. We've got Claire and Emily observing us today. It gives a really good oversight of their work, the coverage they give into the system, and I know we'll have private board later today where Claire is joining us for part of our development session. So yeah, any questions, happy to take them, but there's lots of detail in there.
That point that Claire raised, Natalie, a moment ago.
Yeah, so I'll pick that up with Claire outside the meeting if that's okay, because we do have a training programme that comes into our private board sessions, but I think the paper's slightly different to that. I think that the board development sessions are something more bespoke.
Thank you. So Claire, you can look forward to Natalie updating you on that. Thank you very much indeed. So we can note those two reports have been held elsewhere. Signature and sealing of documents, just for our information, Unit D, 178 Wide Marsh, 2-year lease. There then have been no advisory appointments, committee appointments in the relevant period. Unfortunately, it's always good to see some names in there, but this time we haven't. Which then takes us to any other items that we think may be or should be included as part of our board assurance framework. Does anybody have anything? I have one that's come to mind. So if I suggest that, and I'm not sure, it's this thing around data and our ability to work together with partners to get the data we need to drive the changes we want. And that's not just within ourselves, that's across the whole system. I'm not sure that's reflected adequately as one of our risks. It strikes me that as we try to improve our organisation, every aspect of our improvement programme tends to fall back into the data world to get the proper evidence. And we are all personally trying to do better. That's collectively and individually do our jobs better. And we tend to desire more information, more evidence, more data, which we know will put more pressure upon basically Charlie and Charlie's team and elsewhere. I wondered if that's captured adequately within our BAF, because it does strike me as a risk to all that we want to do. Just a thought, Robert.
I think it's actually quite a good thought. We just need to look at, and it probably it might talk a little bit to the two elements that Lisa referred to that we'd identified and talked about, which is really these strands about actually how we join systems up and I guess get the data out of that, and actually how do our patients, carers, users, citizens get access to information, how we do that. So can we take that one away as an action, Mark? We will look at that, but I think that for me it does seem there's something in there. I was just going to add the only other point I would say is I think it's probably self-evident, but the outcome of wherever we end up as a system from the planning round and where we go into next year will need to be properly reviewed and assessed against those strategic objectives that we have in the BAF, because there may well be some impact on some of those.
Thank you, Robert. Yes, a good point. Veena.
Can I just make the point that yes, more data is always helpful and useful, and it's important for us to be evidence-based, but I would ask that we really bear in mind that the size of the team we have. Charlie and her team are producing a scary amount of work for us already, and we do need to look really carefully at their capacity. It was something that we actually talked about at Workforce Committee this month as well. So I would really keep that at the forefront of any discussions that are going on.
I think you're absolutely right, Veena, and I think, Robert wants to come back in, but Denise, you're now the gatekeeper, so to speak, from an executive level there. I think Charlie and her team are victims of our desire for improvement and some sort of successes in some way. But Robert, then Lisa.
Yeah, I completely agree with that, Veena. I know you're aware because we've talked about it. Personally, for me, actually, the focus of this is about how we join things up and how we use that across the system. It's the use of some of the things like the NHS app, it's the federated debt platform, it's the shared care record, rather than more things we're asking our individual teams to pull out, although I obviously recognise we'll change our focus and prioritisation around what it is we need. I think this is a slightly broader issue for me personally, but we just need to have some discussion about that. But I completely agree. We can swamp ourselves in data, and there's always a risk that we say we can't do anything just now because we just need to wait for X, Y, or Z. And actually, we've got maybe 80%, 90% of what we need to allow us to get on with things. So we've got to avoid that paralysis by analysis thing, haven't we?
Thank you, Robert. Lisa.
And just to pick up that point, really, I think, so I've been having conversations with Charlie as to how we can make the data warehouse we've got within the organisation better and automate more information that comes out of that, and how we can make it easier for people to see what that will look like without the involvement of Charlie and her team. But also to think about, as Robert said, within the integration model, how do we get data from other organisations without it being a draw of more resource from Charlie's team. So that whole element of making information more accessible and more meaningful, but with automation rather than manual processes, is where we'll pick up the strategy.
Thank you. So if this could be considered within the BAF somehow, Martin, you're doing your work well. You've even started to influence me more now, raising these things. So you're clearly having an influence on me. Okay, if that could be captured then, which then takes us through to any other business. Any other business is Link Nursery, and the fact that we were served notice on our current tenant moving on. This is not a matter reserved or delegated to board in any way, but I did think it's a matter of local public interest, so I wanted it to come to public board. And because we've had a development relatively recently, I didn't want it to wait another 2 months for our next public board. Hence, I've accepted it and suggested it as an AOB. And Sue will explain how we're going to do that, Sue.
Thank you, Mark. And obviously the paper is very succinct. The background we've been through before in relation to becoming a landlord for the Link Nursery site, with Warwickshire College Group operating from within it. So you say they've served notice and coming out at the end of July. We had a couple of interested parties initially, but actually we put a process around that so that we could transparently agree how best to move forward. In the end, we actually received one proposal, which was from Stepway. Stepway have got a track record really of doing great work and support for veterans and their families, but their offer is always integration with the wider community. So they run wellbeing centres. They've got one in West Bromwich, and the activities and the offer from there is they're really comprehensive. And to say the intention is to keep with what is already there in Link, and then grow it and develop it and do that with the local community as well as with the veterans and their families. So, I mean, what a great way to finish at the end of board meeting. And it looks like such a great opportunity for local people. We're an Armed Forces Covenant employer and provider. So for us, this is very much in line with where we want to see support developing and expanding for veterans and their families. So at the moment, when we put this proposal against the criteria, it passed with flying colours. So as you say, Mark, this is really today for board to consider a note, but we want to move to agree the heads of terms with the lease between ourselves and Stepway.
Thank you, Sue. It's a great development and hopefully removes uncertainty around that site. And having personally read their proposal as well, although I had nothing to do with the evaluation, it's an impressive proposal and looks like it will enhance what has gone on there in the past to make it better. So if board can note that, it's within the chief executive and his team's gift to agree these things, but I just wanted board to be aware and for it to be on public record. Okay, if we can note that, thank you very much indeed, and thanks Sue for doing that relatively quickly. I know in the last 24 hours you've been putting something together for board. For those of you who haven't caught up with the paper, it has been placed upon diligence. Okay, that is the final part of our public meeting. Our next meeting is on the 18th of July. Thank you to everybody today for your participation and getting us finished. I think this is a record. 13 minutes, 12 minutes ahead of time, maybe speaks to our effectiveness. We've had a paper on that. We are due, according to the agenda, to kick off our private session at 1:30. May I make